Hey everybody, welcome back to my channel Experience Arc. My name is Becky Cook and today we are going to be talking about PTSD. PTSD is definitely very prominent in today's discussion when we talk about mental health. I think it can be a lot more prominent. I think a lot more people need to know exactly what PTSD is and exactly how people with PTSD are affected in day-to-day life, and we'll be talking about that in this video. When it comes to PTSD or acute stress disorder, the simplest definition for these disorders would essentially be very specific symptoms that occur in the wake of some sort of traumatic experience. So when we talk about traumatic experiences, a lot of times people discuss the word trauma. And when we talk about trauma, typically what we mean by that is an emotionally overwhelming experience. An experience in which there is a real or perceived serious threat of danger or the possible death or serious injury or illness of yourself or a loved one. So essentially, people can experience trauma themselves and be victims of a traumatic experience, as well as also be essentially secondhand victims of a traumatic experience. So when we talk about PTSD and acute stress disorder, sometimes people are more likely to have acute stress disorder in the sense that their symptoms of PTSD or their symptoms of stress and anxiety from a traumatic experience don't last as long as PTSD. So if someone's symptoms last more than 2 days but less than a month, are accompanied by dissociative symptoms and cause a significant distress to the person, a diagnosis of acute stress disorder would be more accurate for them. If the stress and dissociation symptoms last longer than a month and last longer than a month after the trauma, then a diagnosis of PTSD will occur. So commonly if someone, goes to see a specialist beforehand, before that essentially 1 month period, they're more likely to receive a diagnosis of acute stress disorder. And if their symptoms continue after that month, then they might change over to a PTSD diagnosis instead of acute stress disorder. So when it comes to these stress disorders like PTSD and acute stress disorder, much of what we know actually comes from victims that have experienced traumatic events. And the most common victims that we typically get information from are those that are survivors of war. But there are many different kinds of events that can be considered traumatic and can give someone PTSD besides war trauma. This can include natural disasters as well as man-made disasters. So many people can have PTSD from, experiencing a natural disaster like a tornado or a hurricane. Many people after Hurricane Katrina actually dealt with a lot of PTSD symptoms. And then there's obviously man-made disasters, and a very common man-made disaster that people talk about in association with PTSD would be 9/11. And traumatic events can also be considered to be more day-to-day items and events that happen to people. A common event that can be traumatic for someone is the loss of a loved one. Another one could be a car accident. The essential thing that we need to remember when we talk about traumatic events is that they're going to differ with every single person. A traumatic event is never going to necessarily be a one-size-fits-all. For some people, certain things will be very traumatic, and for others, not much. Trauma will be associated to that. 3 key things that accompany a traumatic event has to be terror, horror, and helplessness. So when we see PTSD, there is a lifetime prevalence of over 8%. On top of that, 90% of rape survivors, survivors of war, and survivors of concentration camps such as the Holocaust do develop stress disorders, whereas 5 to 10% of people develop a stress disorder after a serious car accident. So now we're going to talk about the diagnostic criteria with PTSD. So obviously one of the main diagnostic criteria is that the person has experienced some form of traumatic event that elicited terror, horror, or fear in any capacity. On top of that, the traumatic event is going to be re-experienced by the person in numerous different ways, such as reoccurrent, intrusive, and distressing memories of the event, recurrent distressing dreams about the event, having flashbacks in which the person is acting or feeling as though they are reliving that event, dealing with triggers. And so triggers are typically intense psychological distress when exposed to internal or external cues that remind someone of the event. When someone is triggered, they can also experience physiological reactivity. So this can be like sweating, chills, heart pounding, and essentially many times this can resemble how they physiologically felt during that traumatic event that they experienced. On top of that, someone with PTSD is going to typically try to avoid anything that would remind them of that traumatic event, and they may even experience a numbing of general feelings, and this can be indicated by the following. So there's going to be efforts to avoid the thoughts, feelings, or conversations associated to the trauma. They'll make efforts to avoid activities, people, or events that may have these traumas reoccur to them. There's also this inability to completely accurately recall the events of the traumatic event. So one thing we do need to remember is that many victims are going to have lapses in memory, and we have to recognize that part of that is a mechanism to protect themselves. On top of that, there's also a markedly disinterest in activities that they may have previously liked. So, you know, if someone really enjoys certain events with groups of people, they may heavily reduce going to do that. They also can experience a feeling of being detached or estranged from others, especially their friends and family. There's also a restricted range of affect for these people. And discussing kind of like that numb feeling again, they have dulled emotions and a lack of certain feelings. And many people with PTSD also have this sense that they have a foreshortened future. A person with PTSD can also experience persistent symptoms of increased arousal as indicated by the following. So there's difficulty falling asleep or difficulty staying asleep. There can be irritability or outbursts of anger. They can also experience difficulty concentrating. There's the possibility of hypervigilance. There's also the possibility of an exaggerated startle response. So the last diagnostic criteria is that this disturbance essentially causes significant distress and inability to live a normal, productive life. So there's some sort of impairment in their normal functioning. So when it comes to causes and risk factors, traumatic experience, that's the #1 risk factor for PTSD and acute stress disorder, is you have to have experienced a traumatic experience. There is debate as to whether or not there's biological foundations in this. I think that it's very possible for someone to be more biologically prone, as well as more emotionally and psychologically prone to PTSD. So earlier I did talk a little bit about a flashback, and so a flashback is typically one of the more extreme forms of re-experiencing a traumatic event. And when this happens, a person generally feels like they are reliving the traumatic event all over again. And this can occur even when they're in a safe, familiar environment. Many people who have experienced some form of a traumatic event also have almost like this over-arousal. So typically they'll feel overly aroused, irritable, edgy, or tense, even though they may feel emotionally numb. They may also have difficulty managing frustrations, and they can become chronically irritable or angry. Symptoms of PTSD can last for years, if not lifetimes, and I think lifetime is definitely much more accurate when talking about this disorder. People who suffer from PTSD also have elevated rates of substance abuse, depression, as well as other anxiety disorders. So, you know, people that have experienced a traumatic experience may engage in substance abuse to relax themselves and to kind of maybe even get rid of that feeling, get rid of the feeling of numbness, or get rid of that memory. Trauma can also be chronic, and this can be, you know, experiencing living in extreme levels of poverty or in a dangerous neighborhood, a dangerous household of some sort. So trauma isn't necessarily stagnant. And lastly, when looking at treatment for PTSD, you'd be most interested in doing trauma-focused psychotherapies, since PTSD, is directly linked to a traumatic experience, you want to obviously get to the root cause. This can include cognitive processing therapy, known as CPT, prolonged exposure therapy, eye movement desensitization and reprocessing therapy, and then there's also medications or combinations of medications that people with PTSD can take to help reduce their symptoms. Thank you so much for watching, guys. Please like, comment, and subscribe. I will see you guys next Monday. This will be the last video on anxiety disorders, and next Monday we will be talking about mood disorders from there on out until we finish those. So I will see you guys next Monday when we talk about major depressive disorder. Bye, guys.